I grew up in Boston, Massachusetts, the youngest of 8 children. And every summer in the 1960s, our parents would drive us from Boston to rural Alabama to visit extended family. Our mother prepared meals for the trip. Our father drove us in a 1956 Ford station wagon. We would take travel breaks on the side of the road, eat the food our mother prepared for us, relieve ourselves behind the trees and the shrubs, get back in the car and drive until our father got tired, and then we'd sleep at a rest stop in the car, all of us, all 10 of us. It was great fun. Our father would start to drive again, and while we were sleeping, he would try to get some roads behind him, and then each of us would begin to wake up, and we would say, "Are we there yet?" Fast forward about 10 years, I began to understand what my older brothers and sisters already knew. The reason we traveled the way we did was not because we were poor. It wasn't because our parents were in a rush. We traveled the way we did because our parents were protecting their children from the horror and the terror of legalized racial segregation and discrimination in the South, known as Jim Crow laws. You see, at that time, African American people could not eat in the same restaurants as white people. We couldn't use the same restrooms or sleep in the same hotels. And if we did, we could have been arrested and placed in jail. Fast forward another decade or so, I became a young medical doctor working in previously racially segregated hospitals in the South. And as I thought back to those trips, I realized that our family, traveling through those cities and other families that looked like us and lived there, could have been denied or had limited access to health care. In 1966, Dr. Martin Luther King said, "Of all forms of inequality, injustice in healthcare is the most shocking and the most inhumane." Yet, half a century after he made that declaration, we continue to face inequalities in healthcare. I want to speak to you today about health equity, about systems and structures that have created and perpetuate inequalities in healthcare, and think about some solutions where all people can be as healthy as possible. The CDC defines health equity as where everyone is able to achieve their full health potential, and no one is disadvantaged from achieving that full potential because of their social position and their socially determined circumstances. As a nephrologist, kidney specialist, I see health disparities on a daily basis. African Americans, Asian Americans, Hispanic Americans, and Native Americans all have a greater incidence of kidney failure than do white individuals. But the disparities for people of color does not end with kidney failure. High blood pressure, diabetes, obesity, COVID-19, pneumonia, heart disease, stroke, cancer of the prostate, breast, stomach, colon, greater infant mortality rates, and lower life expectancy. But it's not just about disparities. Disparities equals loss of life. In 1985, the U.S. Secretary of Health and Human Services, Margaret Heckler, commissioned a report entitled Black and Minority Health. That report revealed that on an annual basis, 59,000 black lives were being lost. And over 30 years later, that number has increased to over 74,000 lives. So why do we have these disparities? Is it because of racial differences? Is it because of genetic predispositions? It has nothing to do with either of those things. The Human Genome Project in the year 2000 mapped out DNA sequences of people throughout the globe, across the world. And it showed that from a DNA perspective, we, you, me, all of us, are 99.9% identical. There is no race gene. We are all part of the human race. Health equity is not about biology. It's really about sociology. Several years ago, scientists and health experts began using the term social determinants of health to suggest that 80% of our health outcomes is related to where we're born, where we live, where we work, where we age, our race, a social concept, and ethnicity. 80% of our health outcomes are related to social influences. Now, let's put this in a historical context. Health inequality has been embedded in American life systemically and structurally through racial oppression and segregation of populations, including the indigenous population to reservations, the enslaved African population to plantations, the Jim Crow South, which I mentioned already, and racialized urban communities. Social policies of the past and government policies of the past affect us today. Back in the 1930s, after the Great Depression, the Federal Housing Administration was formulated. It was created to create generational wealth, to stimulate the economy, to assure that homeowners were able to be created through the federal government backing mortgages. Unfortunately, discrimination tainted that whole program. Communities where people of color were located, in particular African Americans, those communities were mapped out as red or D, hazardous for repayment of loans based upon no evidence. People in that community, because they were people of color, couldn't leave. And so they had to stay in those communities. Over the years, those communities became decayed, under-resourced, and impoverished. Those communities previously redlined today are some of the poorest communities with the greatest disease burden and poverty in America, mapped out throughout the country. When you think about previously redlined communities, think about Flint, Michigan with lead in the water. Think about Jackson, Mississippi with no water. Think about the Roxbury section of Boston where I grew up, which has a 30-year life expectancy gap lower than an adjacent community. Those communities, previously redlined, are communities that are food deserts with no grocery stores and food insecurity. They're medical deserts with no health care whatsoever. And there's a paradox in that large health systems, nonprofit institutions that make billions of dollars, continue to invest in communities with institutions in communities with the greatest life expectancy, lowest infant mortality rate, highest per capita income, ignoring those communities of incredible need. The iconic author, James Baldwin, said that history is not the past, it's the present. We carry it with us. We are history. When I think back to those trips from Boston to Alabama, I am saddened to say that on the path to health equity, that we are not there yet. But we have made progress. The Civil Rights Act of 1964 eliminated Jim Crow. Medicare and Medicaid created the opportunity for senior citizens and the disabled and poor children to have access to health care. The Affordable Care Act added 20 million individuals to insurance rolls, and the American Rescue Plan reduced childhood poverty by 50%. We've made progress, but there's so much more work that needs to be done. I want to leave with you several ideas about how we can continue to impact health outcomes. Number one, in communities that are food deserts, incentivize grocery stores and grocery chains to invest and do business there with tax incentives and tax credits. Number two, large non-for-profit hospitals. Nonprofit hospitals need to be accountable to communities of need. If they're going to call themselves nonprofit institutions, they need to do good for the public. Number three, restore, repair, and reinvest in previously redlined communities so we can interrupt that cycle of generational poverty, which impacts health. Number four, universal health care, Medicaid expansion. It's really a no-brainer. Many other countries do that, and we certainly can do that. Number five, racial equity training so people know the why about how we got to where we are today, with health inequalities and health disparities. You, me, we, our society, we need to understand that it's our responsibility to correct the social injustices that have created health inequalities, so that no matter where you're born, live, work, or age, no matter your race or ethnicity, everyone deserves an opportunity to be as healthy as possible. Because it's not about biology, it's about sociology in our society. It's about us. Thank you.